You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, why don't you go ahead and introduce today's guest?
Hi, my name is Ivan Zek, and I'm happy to introduce a colleague of mine, Dr. Jennifer Ogeer. We're going to talk about the artificial intelligence in diagnostic space, but I would like to start with introducing Jennifer and her long-lasting business career, which is innovation on its own, I think. So Jennifer's long-lasting business career started as a DVM at University of Guelph. She also did a residency and master's in critical care medicine. She did an exec MBA and master's in organizational behavior and leadership, and all at University of Guelph. Currently, Jennifer is a vice president of medical affairs at Antech Diagnostics, and we met in person and as colleagues at IDEX, where Jennifer was medical affairs marketing manager. She also is a vice chair of board of directors with Veterinarians Without Borders in Canada and finance chair of directors at OVC Pet Trust. Woo, what a career. On the personal side, she has 7 pets, 5 cats, and 2 dogs. They are all rescues, and she enjoys athletics such as cycling, running, weight training, and mixed martial arts. You are an innovation as a career. So can you maybe introduce us to how did you roll in such short period of time all of these educations into one direction, and how did you kind of pivot along the way?
Thank you, Ivan. It's really been, I think, a lifelong pursuit to be able to think about how, as a veterinarian, I can help people and their pets, and also how I can contribute back to community. And so in my journey of my education, I have sort of sought opportunities to be able to not only as a doctor and a medically oriented person, be able to incorporate the elements of business intelligence, as well as, what I call a high level of emotional intelligence. And I think particularly in the area of emergency medicine and critical care, where many times we're dealing with patients with life-threatening conditions and pet owners who oftentimes are in severe distress and even in tragic situations that they themselves are dealing with personally, not even just with their pets. It is an important area where we have to understand that, emotions and the psychology and well-being of our pet owners, as well as sort of the individuals we teach in academia, and how we actually can sustain ourselves as veterinary care workers and nurturers. And so I think my journey for my education has been a very cohesive path around sort of building that intelligence on an emotional level as well as an educational level, and being thoughtful as a leader and innovating in the path that I will talk about today with diagnostics and imaging.
Wow. It's certainly impressive. Sometimes I'm thinking about, people not getting motivated to do certain things. And then I'm trying to finish my MBA right now, and I'm kind of procrastinating on dissertation. So this definitely puts me to shame and motivates me to finish it. So I appreciate that. So 2 diagnostic giants, IDEX and Antech. And, you just worked at IDEX and now you joined Antech. I know that it's hard to give these interviews like this, working for these large companies, especially with the, all the PR departments. And so I definitely dealt with this. But is there anything differentiating between the 2 companies? As a veterinarian, I'll put it from this angle. I'm a vet, and I'm just, I'm starting a new practice. I'm thinking about 2 diagnostic companies. I'm thinking I want to be with one or another, left aside the pricing and everything. What is new, innovative about Antech that we can learn from you, since you just joined it and maybe learned a lot of stuff there that would be exciting for veterinarians?
So I think in general, Ivan, as a veterinarian, you also know that the patients we treat oftentimes cannot speak to us. They don't communicate clinical signs. They don't communicate how they're feeling. And diagnostics really is that portal. It's that gateway that gives us an opportunity to sort of give that pet that ability to communicate with us indirectly and through understanding what that diagnostic information is giving us, what is going on with that patient. And so I think, as I think about, as a veterinarian, when we approach a diagnostic company, it really is about where am I able to build a relationship with that organization or that group that's able to provide me with the tools and the innovations that allow me in a very sort of practical, sort of easy to do business, relationship-based way that they understand what we deal with challenges as practitioners. And then how do I access that diagnostic information easily so I'm able to actually integrate that into my own practice management systems and then actually communicate that information back to a pet owner in language that is understandable to them and makes sense for what they deal day to day with their pets. And so when we think about diagnostic companies, there are many of them out there. And I think what differentiates, Antech in particular as a diagnostic company is we're a company that we're very relationship-based, we're easy to do business with, but we are also innovators in what we're doing diagnostically. And we currently have been putting a lot of new innovations on market. And one of our most recent has been RenalTech, which you probably heard about.
Excellent. So RenalTech, yeah. So what I heard about it, and I would like to hear more, is that this is a predictive measure of certain parameters on the blood work that will tell you the likelihood of the cat of getting renal disease in the future. That's how I understand it. And from what I understand, and this is the topic of the conversation, it is powered by AI, and which is also sort of the area of unknown that one of my developers on my previous team told me this developer joke. I hope everybody will appreciate it. So the difference between the artificial intelligence and the machine learning is that machine learning is written in the computer code and artificial intelligence in PowerPoint presentations. So I guess that's developer joke. But can you tell us more about RenalPet and how it works?
Absolutely. I will not get into a discussion between the difference between AI and machine learning, but I think, most people are aware that AI or artificial intelligence or, what some people refer to as augmented intelligence really is using a computer to mimic human behavior in some way. And this idea of machine learning really is just a subset of that, where we use techniques and these computers figure out things from a lot of data so they actually can give us these applications. And so one of the applications that we have as an innovation from Antech, which I will also mention, very excitingly just won the Best Companion Animal Award of 2019 from Animal Farm, is RenalTech.
Wow.
And so RenalTech is a new kind of predictive diagnostic tool, and it's really based on deep analysis of large amounts of data using artificial intelligence and machine learning. It's unique in that it's shifting the paradigm from detection of disease, which is what we traditionally do as veterinarians, to actually predicting disease before it occurs. And in this case, RenalTech is predicting whether or not a cat will develop chronic kidney disease sometime within the next 2 years with greater than 95% accuracy. And I think that is exciting because as veterinary practitioners, we're now actually able to identify whether these cats are going to develop a disease or not. And I think for those of us who are practitioners who listen to this podcast, we know that this is a disease that has a very high prevalence within our feline population. It's one of the leading causes of mortalities in cats. And so if we are not able to diagnose these cats until they are advanced in their disease, it does limit our opportunity to do something therapeutically and management-wise to be able to help these cats. And so if we are able to predict disease prior to the actual diagnosis, it then allows us to develop these personalized care plans for these cats that may actually be able to delay the onset of this disease, as well as maybe even slow the progression of this disease. And I think one of the other important elements about this that very much relates to diagnostics is, when we think about feline renal health, the kidneys are an important organ in the body, and so there are many other conditions in the body of our feline patients that may contribute or predispose a cat to loss of kidney function. And so being able to predict this disease is an important part of this innovation. But what also happens is if we do diagnose or predict rather that a cat is a positive RenalTech cat, meaning that it's likely going to develop chronic kidney disease sometime within the next 2 years, we then can start to investigate for comorbidities or even concurrent conditions that then help us figure out, is this cat predisposed to a disease that's going to lead it to develop chronic kidney disease? And I think one of the common ones most of us think about is something like feline hypothyroidism. So we're really thinking about the overall feline health of our patients. It's not just kidney health. And diagnostics are a valuable adjunct to sort of looking, as I said, that giving us that window into what our patients can tell us is going on with their organ systems.
It's really, really interesting, Jennifer. I love AI. I love reading on it. I love being confused by it. And it has a tendency to do that to most people. But I'd like to ask you a little bit more about your modeling, the AI modeling. Where did you get the data from to build the model, to do the predictive analytics? And what is it looking at? What are the key factors that really trigger the ability of the algorithm to produce results when you get that diagnostic information?
RenalTech is actually a global collaboration of many groups that are within the Mars pet care ecosystem. And so that includes Antech Diagnostics, it includes the Waltham Pet Care Science Institute, it includes Mars Advanced Research Institute. The data was pulled from the Banfield Pet Hospitals. So we looked at over 20 years of retrospective data. There are about 150,000 cats that were included that met the criteria to actually build a model, and there were over 600,000 hours of computing that were put in from a group that we collaborated with called the Process Integration and Predictive Analytics Team. They're based in Davis, California. And then we also worked with Dr. Jonathan Elliott, who is a world-renowned nephrologist and a member of the International Renal Interest Society Board, and he's based at the Royal Veterinary College in the UK. And so for years, Mars Pet Care has actually been using machine learning to analyze pet health data, and they've been using it in support of their biomarker science program and using it in ways that help us transform how veterinarians predict and maybe even sort of diagnose disease. And so this particular tool is based on using all of this data. It works on what's called recurrent neural networks. And these recurrent neural networks are then used to identify patterns and trends from these large databases that includes anonymized patient data. And then we use that and we develop algorithm using proprietary equations. So what the tool uses is it uses 6 common feline health parameters to deliver a RenalTech status on that cat. And so that patient is required to have 2 data sets with 6 parameters that come from a minimum database that we would typically get from a routine wellness or preventive care visit. And so those parameters include a white blood cell count from the complete blood count. It includes a blood urea nitrogen and creatinine from the chemistry panel. And then from the urinalysis, it includes a urine pH, urine-specific gravity, and urine protein. And then it also then incorporates the absolute or approximate age of that patient. So using that algorithm derived from all that anonymized medical data of these 150,000 cats and over 700,000 Banfield patient visits over 20 years, this RenalTech tool was developed to predict whether these cats will develop chronic kidney disease or not in the next 2 years with a very high statistical accuracy.
That's incredible.
It's amazing.
So from the practical point of view, I listened to this, I think it was some sort of a forum in Russia, and there was a professor from MIT pointed out why Russia invented a lot but didn't innovate a lot. And he made a distinction between the invention and innovation. So invention being something really cool being discovered, and innovation actually putting it into the field, into the practice, and creating business around it. So as a practitioner, when I am using Antech Diagnostics, how do I get access to it, and what does it look like? Is it a part of the blood work? Is it just something that is generated along the way? What is the actual application of it, and what does it look like to the end user?
So RenalTech actually is provided to all our Antech customers free of charge. So they do not have to request a RenalTech status on their feline patients. Once that we have within the database the two data sets from that patient that includes those 6 parameters, the algorithm will be run on the data sets and will be able to generate a RenalTech status. And so when that veterinarian gets that RenalTech status, which falls into one of 3 categories, which is that cat could be positive, it could be negative, and then we have a very small percentage of the cats that may get an inconclusive status. And what we're seeing is about 20% of the more than 100,000 statuses we've reported so far are inconclusive. And really it just means that there's additional data needed for us to report whether that cat's going to be positive or negative with statistical certainty. And most of the times, it's typically that we don't have the urinalysis data because maybe that veterinarian could not get a urine on that cat, for example. But in terms of what does this mean, we give you the results. Again, they receive that as a report that comes once we have the information on the patient. They get that at no additional charge. And then if that cat is a RenalTech positive cat, what does that mean in terms of the veterinarian having as an application of that status? What it means, they now have an opportunity to really have a conversation at a much deeper level with that pet owner about, let's start monitoring this cat more closely. Let's start looking to see if they're actually eating good, high-quality diets. Is that cat developing, signs that typically we may not notice, particularly if we're in a multi-cat household? Like, are they going to the litter box more often? Maybe they're not eating as much, and maybe they're losing weight. And maybe also if it's a cat that's greater than 7 years of age, rather than wait on an annual basis to come back with that cat, maybe bring that cat sooner so we can reevaluate that cat maybe at 3 months or 6 months, so we can actually identify at what point that cat does actually develop or go into that diagnosis of chronic kidney disease. And so I think this having the ability to have a status on a cat allows us to sort of really engage with that pet owner and that pet on a much deeper level and really develop these personalized care plans. Another great example is, we know one of the risk factors for cats to develop chronic kidney disease is if they have moderate to severe periodontal disease. And we're seeing more and more awareness as, our pets become our fur babies and they spend more time with us, they sleep in our beds with us. We're probably more aware of what their teeth are like or what their breath smells like. And so if we can actually have that pet owner sort of have a good oral care program at home, and we as veterinarians institute a dental care program with them, we're again in a position of being able to maybe delay the onset of a very serious disease like chronic kidney disease. So I think there are very actionable items that as veterinarians and caregivers to these pets and to pet owners who are so deeply involved and emotionally attached to their pets, that they then also have something that they can do where they feel they're much more involved day to day on what's happening with that cat.
That's amazing. And Jennifer, one of the things that really stood out to me in this conversation so far is the unique ability for the Mars organization to attack these diagnostic opportunities because of the data that has existed within the organizations like Banfield and the other companies that fall under the umbrella. It appears very much that Antech, under the Mars umbrella, has a very unique ability to not just solve this issue, but many other issues. And I guess one of the things that I'd like to ask, is there anything else interesting that you guys are digging into that leverages AI that you can talk about?
Absolutely. So we are also using artificial intelligence in other ways. We are currently working with the Mars Next Generation Technology Group with our Antech Imaging Services, and we're using artificial intelligence to sort of refine the way we automate reading of ECGs. We're also looking at using artificial intelligence and machine learning and what we call sort of natural language artificial intelligence to sort of help us with how we improve the efficiency of reading radiology reports, for example, like what is, a normal or an abnormal thorax, for example, the area of point of care cytology, which is something that I think is becoming more and more topical in veterinary medicine. Are we able to look at these digital images of cytological specimens, and as we store these images in the cloud and we look for these patterns, are we able to maybe define a cell structure or a cell type more definitively? So I think this idea of artificial intelligence and machine learning is permeating through the entire realm of diagnostics and imaging, not just from the element of being a predictive tool, but maybe also helping us in terms of the actual diagnosis. One of the areas that we are also working on with imaging is, can we predict, from sort of what we call as the pen-hip area, is at a very young age, is that dog likely to develop hip dysplasia, for example? And so all of those are, I think, important applications of machine learning. Can we maybe also use this in cancer patients? Are we able to look to see what's happening as we plan serial studies or we manage and treat cancer in our veterinary patients? Are we able to use AI to quickly and maybe accurately determine what are the differences between studies and maybe even what's the effectiveness of our treatment, as imaging is a huge part many times along with radiation therapy for our cancer patients. So I think this world of natural language AI and machine learning is just sort of really going to become the future of diagnostics and be an important element of what we use as veterinary practitioners and diagnosticians.
This topic is so interesting. I think if we had about 3 or 4 hours, we might have a good start to where we could end up kind of going around with this, because I have so many more questions that I'd like to ask you. And really, one kind of final comment from my side would be that it very much appears that you guys have the perfect storm to really tackle some of these very difficult issues when it comes to taking the data and putting mass computing power behind it. But with that said, we're really running out of time, which is super unfortunate, but we've got a couple of questions that we'd like to throw your way before we wrap up. One is, with an education career like you've had and so much exposure in the veterinary field, what's one thing that you've come across, whether it's a book, a TED Talk, a YouTube video, that you'd like to share with our listeners?
So, one of the things I have come across that I believe has sort of really been an important impact on me as a person has been the idea of collaborative intelligence. It's this idea of how as humans we are using AI and joining forces to be able to take technology as well as our clinical acumen, our integrity of knowledge and the information we have to be able to put together this fusion, this ability to integrate technology, but that judgment we have, that intelligence that we develop, that social and emotional intelligence to be able to bring forward to what we do day to day in our lives, but also to what we do for our patients in a very exciting way. And I know it's something that's been talked about with, a lot of the Harvard Business Review folks and a lot of social scientists. And so I think it's really exciting. We're using intelligence in a way that doesn't mitigate against what we know as human beings, but we're using it to actually make us better at what we do and to actually do it in a way that is efficient. It's getting us into a more personalized approach of how we interact with each other and what we do for our professions. And so I think this is a really exciting area.
That's great. And then a final question is, what other innovator that you know in your network do you feel we should have on the show?
Dr. Paul Fisher, a colleague of mine, has been an inspirational innovator to me. His ability to look at natural learning, artificial intelligence, and machine learning and implement that into the imaging services and the clinical applications and the efficiency it will bring forward to us as veterinarians really has been impactful. He's continuing to work in this area, and I believe he would be someone who would be a huge innovator in the future and someone you should speak with. I think, as we all appreciate, diagnostic imaging specialists in veterinary medicine are at a major shortage, and the work that Paul and his team are doing in collaboration with the Mars Pet Care Next Generation team is just incredible, and I think he would be a huge asset to your podcast.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.